This morning, I ordered 1,050 members of our Ohio National Guard into our hospitals to help our hospitals deal with the very serious situation that they are now facing. In addition to that, we are now working with an Ohio healthcare staffing company to help our hospitals meet their staffing needs. This will allow for Ohio hospitals to bring in qualified nurses and other medical personnel from out of state to fill needed positions and help ease some of the pressure on hospitals and their staff over the critical holiday period. While the staff will be concentrated in the places where they're most needed, the entire state will feel relief as the arrangement supports the coordination of patient care that has been happening really since the beginning of this pandemic. Ohio has had a unique plan that we have executed every single day since the pandemic started, of great coordination with our office, along with their hospitals, where the larger hospitals were helping the smaller hospitals, and where unprecedented coordination was taking place. That continues. Earlier in the pandemic, our concern in our hospitals was about beds, was about space. Today, it is about personnel. 22 months of this pandemic has taken its toll on our healthcare workers. And that is certainly understandable. We cannot thank them enough for the work that they have done and the work that they continue to do. 22 months they have fought this war. And I want to thank them and thank them again. We are very, very grateful. In a call this morning that I had with hospitals over our state, one of the administrators told me about a story that's kind of typical of what our hospital personnel, our nurses and others are doing. He talked about nurses at his hospital that got off at 4 p.m. the other day, went home, maybe got something to eat, got a little sleep. They were back at the hospital again by midnight that night, taking care of patients. This is happening all over the state of Ohio. This pressure, the stress that they're facing is unprecedented. Let's look at it by the numbers. Today, we have 4,723 of our fellow Ohioans who are in our hospitals because of COVID. Now, to put this in perspective, this is the highest number of patients we have had in our hospital from COVID since December 2020. In fact, the date was December 22nd, 2020. We are also approaching an all-time high number. We're not too far away. As a result of this high patient count and hospitals being understaffed, almost all hospitals in Zone 1, which is the northern part, going right across the northern part of the state of Ohio, almost all of those hospitals have stopped elective surgeries. Those in the middle tier, some have already paused, and we are told that others will be pausing in the near future. Those in the southern tier are making plans now to do that when that is necessary. This, I think, demonstrates the gravity of the situation that we are in. This is the situation that our hospital administrators described to me. Really a perfect storm. One, we are now at a very, very, very high level of this delta. Number of cases, number of people in hospitals. The much more highly contagious Omicron is here, and it's fast spreading in the state of Ohio, as it has everywhere else. Number three, flu season has almost started. And the professionals tell me that they expect a regular flu season. Last year, we did not have a regular flu season. It was very, very low. It's because people were being very, very cautious. Many people wearing masks. Professionals expect a regular flu season, and flu season is just now starting to kick in. All those are factors. When you add to that, we're entering now the holiday season. People are gathering together. And again, we're at a point 22 months into this or so when our medical personnel have just been slammed. All of this constitutes this perfect storm. Our high COVID hospital count is being driven primarily by the unvaccinated. 9 out of 10 people who have COVID in our hospital are unvaccinated. That is just the facts. Yet there is hope, and I want to share some good news as we go back and look at the statistics. Let's start with people getting their first shots. In November, 294,000 Ohioans for the first time got a shot, got the vaccine. 294,000 in November, and in December, in the first 2 weeks, 101,000 Ohioans got their first shot. This is good news. Ohioans who had not gotten their shot are getting it. This constitutes almost 400,000 Ohioans in the last 6 weeks. Booster shots. We all know now how powerful the booster shots are. Each day we learn more and more about how well they work. In November, 945,000 Ohioans got their booster shot. And in December so far, 514,000 Ohioans have gotten their booster shot, pushing now close to 1.5 million Ohioans getting their booster shot in the last 6 weeks or so. First shots, more people getting first shots, more people getting booster shots are certainly powerful and a way to get our hospitals more back to normal. Further, with the Delta variant being very high and Omicron spreading fast in Ohio, now is clearly the time for all of us to exercise caution, to be careful. We ask on behalf of the hospitals, if you are going to the emergency room only to be tested, please don't go to the emergency room. There's ample opportunities, other places to go. That just slows down in the emergency room the hospital's ability to care for those who are very sick and who are in the emergency room and need immediate care. If you have a problem, do not hesitate to go to the emergency room, but we ask people not to go there just to get their testing done. I would also suggest that for the next 4 weeks or so, however long this perfect storm lasts, that schools continue to mask or to go back to masking.